Hello viewers, welcome back to my channel. Today we will see about polycystic ovarian disease or PCOD, how it is treated and how it can be prevented. In detail we'll see about the food habits. Please watch through the complete video to get the full information. Please do like the video, comment about the video and share to your friends, subscribe to my channel. Polycystic ovarian disease is very common among women nowadays. We can see 1 in every 3 women have polycystic ovarian disease. There are fluid filled cysts found inside the ovary, and this can alter the entire menstrual cycle. It can cause various changes inside your body. It can also affect conception, and the main reason why people go for fertility treatments is PCOD. Now we will see in detail on what to do with PCOD. The important things that happens with PCOD is irregular periods. They can go into infertility or they cannot conceive properly. There are skin problems also which can arise out of it, and the main side effect is weight gain. This is because of the insulin resistance. I will be explaining it to you in the next slide. And in some cases there can also be high blood pressures. Now we'll see there are 5 important factors which can cause PCOD. The first one is genetic tendency, but this also if it comes along your family line you can have that. And the second one is very bad dietary choices. I'll talk about what diets can lead to PCOD in the next slide. And you have a weakened immune system. And then the junk foods we eat has a lot of toxins which can accumulate inside our body and cause PCOD. And the other most important thing is obesity, and this obesity will lead to insulin resistance that again will cause PCOD. It is like a vicious cycle. I will tell it to you in the next two slides about what happens with this. Next one we will see is what are the foods that can cause PCOD. First thing is taking a lot of dairy products and white sugar. Anything is white is not good for PCOD. White sugar, white flour, white rice, and gluten grains like wheat, rye, barley, and all. Red meat, alcohol intake, and oils, hydrogenated oils, and caffeine. A lot of coffee and caffeine intake, and glycemic index high foods. I will tell you what are the food glycemic index high foods. For people with PCOD, most of them will feel that they are whatever treatment they undergo, they are not able to overcome it. So now this cycle will explain why you are not able to overcome it. So you start eating food, so immediately our body makes insulin. Now what happens is this insulin is what takes the glucose inside our body. Now our cells, because of PCOD, they start inhibiting insulin from getting inside. So whatever sugar we eat is stored as fat. Because it is stored as fat and it is not used for energy, we again feel tired and hungry. Again we eat food. The cycle continues and it continues. So we have to put up a break in this cycle to prevent PCOD or to treat PCOD. Now, what kind of diet we can take for PCOD? High fiber diet. We can take whole grain, green leafy vegetables, cherries, apple, coconut, and coconut milk is very good. You can take juices, broccoli, spinach, beans, peas, and many other foods are there available. Mainly, your choice must be high fiber foods that will make PCOD better. Some foods have been experimented, and it is proven that they can cure PCOD. Few of the foods I have given here: the raw nuts, sprouts, broccoli, onions, garlic, wheatgrass, and brown rice. This you can add more to your diet when you have PCOS, and this will also help you in a certain amount to cure the PCOD. And the next most important thing is the losing of weight, which we will see in the next slide. When I showed the insulin resistance cycle, I showed that weight loss is very important, because once you keep eating, your insulin resistance is there, all this will increase weight. So when you aim at losing weight, then your PCOD, the vicious cycle is broken. As I already showed you the cycle is broken and you are able to come up to your normal levels. Now we'll see how we can lose weight with PCOS. You have to do a lot of exercises with PCOS. The first thing is it helps to lose extra fat. Your exercises should be a combination of workouts, not one simple workout. You can add cardio, you can add strengthening exercises, and full body exercises. These exercises will help you to maintain normal insulin levels and thereby decrease your weight with PCOD. Along with your dietary thing, there is a need for exercise also. Unless you exercise and only go for dietary changes, you will not be able to control PCOD. So it is very important, you have to do exercises, and that to have a combined schedule of exercises. Now we'll see the best PCOS diet. The first thing is you can avoid dairy products, and then you can go on lean protein. Instead of red meat, you can have chicken, you can have eggs, you can have plant-based proteins, and your lean protein can increase. Then gluten free, like I already told you, wheat flour, then barley, some amount of rice even. When you stop all that, or you can completely go gluten free, that is very best for your PCOS. Then sugar intake, because sugar intake, it will increase the inflammation, and it will increase your insulin resistance. As I already told in the cycle, that is not good. So you can also avoid sugar. The next important thing is you have to get enough amount of fiber, that is raw vegetables you can take, fruits you take lots of fiber. And then please don't take processed foods also will help you develop PCOS. So plan ahead, you have to stay active, get more sleep, and then reduce stress. This can also help with the PCOS symptoms. So don't worry if you have PCOS, there is a lot of treatment options available. First, they have to change your lifestyle with nutritious diet, good exercise, and good habits, as I already told you. There are a lot of alternative medicines also available, which you can consult a doctor, or you can ask through the experts available in your area. Then you also have various pharmaceutical options where they give you hormonal combinations, you give anti-diabetic drugs and anti-androgenic drugs. So don't worry if you have PCOS, please take treatment, and you can have a good fertility. Thank you so much for watching. Please do like and subscribe to my channel.